Well, 1 million doses by September is really exciting. But my question is, well, what happens after September? Because 1 million doses is just the starting point. The UK population, if we worked on the number of people who have flu vaccine, plus essential workers, police, fire, NHS workers, social care workers, let's just say we needed 20 million people to be vaccinated, and we needed to do that twice. That's 40 million doses. Well, how long does it take to make the first million? And if we had 1 million doses a week, that's 40 weeks just to get our vaccine. So expectations of huge quantities of vaccine have to be tempered with realism.
Is there a danger that some countries with certain political leadership will attempt to corral the vaccine for their own population to stop it being exported and shared around the world?
Everybody will want to protect their own population, and there will be rationing. A lot will depend, of course, on the behavior of the producers. Now, the producers may define how they handle requests from their customers, and they may come to a view that they will provide their vaccine equitably amongst not just those who can pay high prices, but those who can't afford high prices. So the world has to come to some conclusion about how, when this wonderful resource becomes available, we will share it.
In some parts of the world, people will see it as a matter of national security and will slap an export ban on a vaccine that is made within those borders.
I think that's a very real fear, and I have that fear also, that countries will say, we want to protect our own population first, and they will not allow export, even if the company producing it wanted to export it. So the behavior of governments actually here may be more penetrant in the availability of vaccine than the behavior of the producers.
We have our own SAGE committee in this country. How good a concept is it for channeling scientific advice to those who really need it at the top?
I think that it is a good way to bring together the best possible experts on a topic that you can find. I think that there's no reason actually to keep it secret. I do believe that in a world that we share now, transparency is more important than secrecy. And if people worry that they're going to be pestered, well, they don't have to answer the phone, and they don't have to accept every invitation to give an opinion. So I think the process is the right process to get the best advice. I think it should be the best scientific advice, and it's then up to the government to decide what to do with that scientific advice.
We are all, as a nation, being asked to make a sacrifice by staying at home based on the scientific evidence, we're repeatedly told. But it's very difficult to know what that genuine evidence is, what is being heard within that room.
No, I agree with you that we do have the right to know from whom the advice is coming. Why should we not know? The answer that we're protecting their privacy, I think, is no longer a realistic one. My name is in the telephone book. Why would we want to have such secrecy that you can't know who is helping shape these decisions that are affecting our lives?
It's impossible to ignore that on the 31st of January we were leaving the European Union. How much of a distraction do you think Brexit was to the government in those key early weeks?
All I ever read about in the newspapers was Brexit and preparing for Brexit. I do know that it was very difficult to get non-Brexit pieces of work taken through because of areas where I was involved. Since leaving the Department of Health, I've been very involved in polio eradication on a global scale. And it was difficult to get the UK's interest on just a very small piece of work because it was always being set aside for Brexit. If my one small experience has anything to go by, it was very difficult to get non-Brexit issues to be given priority.